Hi and welcome back to another video of Medic Notes. This video is on hip fractures. A hip fracture is a serious injury, particularly in older adults, and often requires surgery. The hip is a ball and socket joint where the femur meets the pelvis. A hip fracture can significantly impact mobility and quality of life, and it is associated with high morbidity and mortality rates in the elderly population. There are 3 different types of hip fractures, according to their site of fracture. Femoral neck fracture occurs just below the ball of the ball and socket hip joint. Common in older adults due to osteoporosis. Intertrochanteric fracture occurs between the neck of the femur and a lower bony prominence called the lesser trochanter. And subtrochanteric fracture occurs below the lesser trochanter, in the shaft of the femur. The risk factors of hip fractures are: age. Older adults are more susceptible due to decreased bone density and increased fall risk. Gender. Women are at higher risk due to higher rates of osteoporosis. Osteoporosis, a condition that weakens bones, making them more prone to fractures. Medications. Some medications can affect bone density or balance. And other medical conditions. Conditions like Parkinson's disease, stroke, or peripheral neuropathy that affect balance and coordination. Patients with hip fractures may present with severe pain in the hip or groin. Inability to put weight on the injured leg. Stiffness, bruising, and swelling in and around the hip area. Shorter leg on the side of the injured hip. And turning outward of the leg on the side of the injured hip. On physical examination, assess the range of motion, pain points, and leg alignment. For imaging, X-rays are the primary tool for diagnosing hip fractures. MRI or CT scans may be used if the fracture is not visible on X-ray. Treatment can be non-surgical or surgical. Conservative treatment is rarely used, but may include traction and physical therapy for very frail patients or those who cannot undergo surgery. Whereas for surgical treatment, it is the most common approach and includes internal fixation, using metal screws or rods to hold the bones together. Hemiarthroplasty, replacing the broken part of the femur with a metal prosthesis. And total hip replacement, replacing both the socket and the femoral head with prostheses. After the operation, patients go for rehabilitation. This includes physical therapy, which is essential for recovery, focusing on strengthening the hip and improving mobility. Occupational therapy helps patients regain independence in daily activities. And fall prevention, by addressing factors like home safety, balance training, and reviewing medications that may affect balance. For prevention of hip fractures. Bone health, ensuring adequate intake of calcium and vitamin D, and engaging in weight-bearing exercises. Fall prevention, by installing handrails, using non-slip mats, and improving home lighting. And regular checkups, by monitoring bone density and addressing any underlying conditions that may affect balance and mobility. That's all for this video. Thank you.